Now, the State of the Nation address was expected to offer renewed clarity for Kenya's education sector, yet it landed with more echoes than answers. While milestones were highlighted, glaring gaps ranging from stalled transitions to funding controversies were conspicuously overlooked. At a time when schools, teachers and parents are demanding certainty, the silence on critical reforms exposes a sector caught between lofty promises and unresolved realities.
Hey, morning.
Just yesterday, the Council of Governors expressed their frustration with the Social Health Authority, SHA. According to COG Chair Ahmed Abdullahi, SHA owes counties over 10.5 billion shillings, and this has affected the payment of debts, crippling the running of many hospitals across the country. But the president's speech, as was expected, painted a rosy picture of the healthcare system.
Well, apologies for that small mix-up. We were breaking down the story to do with the health sector, and let's just do that. President William Ruto has defended Kenya Kwanza government's healthcare agenda, noting that 27 million Kenyans are registered with SHA, more than triple the number ever reached by NHIF. Additionally, he says more than 10,000 health facilities across the country have signed in under this new system. The president also noted his government has overhauled the Kenya Medical Supplies Authority, KEMSA, to increase medical supplies. However, the real picture shows a sick nation. Many hospitals are owed billions of shillings by SHA, while several others across the country are understaffed and do not have adequate supplies. Our health and science reporter, Chebet Birir, with that report.
Good morning, Hey, morning.
Just yesterday, the Council of Governors expressed their frustration with the Social Health Authority, SHA. According to COG Chair Ahmed Abdullahi, SHA owes counties over 10.5 billion shillings, and this has affected the payment of debts, crippling the running of many hospitals across the country. But the president's speech, as was expected, painted a rosy picture of the healthcare system. According to him, SHA is working just fine.
Over the last 3 years, we have undertaken the most ambitious transformation of health systems since independence. Reforms rooted in equity, powered by innovation, and guided by a simple conviction that every Kenyan, wherever they live and whatever their means, deserves equal care.
But the reality on the ground is different. The Council of Governors has pointed an accusing finger at the national government for micromanaging and mismanaging health, which is supposed to be a devolved function.
And this is the frustration that I have with SHA, that you agree on something and whatever you agree is not implemented. Months down the road, you are where you are, discussing the same thing again.
We have overhauled KEMSA to end the chronic crisis of drug shortages, raising medicine availability from 48% to 68% and to a projected 90% by the end of this year and 100% by March next year. The government is strengthening financial protection for Kenyans under cancer treatment. Social Health Authority will enhance the cancer benefits package from the current 550,000 shillings to Kenya shillings 800,000, effective December 1.
This even as counties continue to record an increase in maternal deaths. In a bid to curb this, governors have demanded a review of a directive that Level 2 hospitals, many of which are the nearest option for expectant mothers in counties, should not offer maternity services. They are asking the government to instead equip these facilities through the Facility Improvement Fund.
Officially, dispensaries are not supposed to be inpatients. And therefore, to curb fraud, they decided the dispensary should not be recognized.
If you don't allow normal deliveries to happen in those level 2s and 3s, you're actually asking mamas to be taken hundreds of kilometers to where there's a level 4, and in the process, you're actually losing lives.
More than 1 year later after its launch, the Social Health Authority continues to face its fair share of challenges and criticism. According to governors, the Ministry of Health under the leadership of CS Aden Duale is keen on reversing the gains made in strengthening the health docket. Chebet Birir, KTN.
Thanks, Birir. To the